Imagine recovering from pneumonia while your kids play in the next room. Or getting 4 antibiotics while sitting in your favorite chair. Right now, 413 hospitals across America are treating people who would normally be in hospital beds, except they're at home. And this isn't some distant future. This is happening today. The hospital, as we know it, is becoming obsolete. I'm not talking about emergency rooms or surgery centers. Those aren't going anywhere. But that sterile room where you recover? The uncomfortable bed? The terrible food? The risk of infections? All of that is being replaced by something that sounds too good to be true. Full hospital-level care delivered in your own home. Today, I'm going to show you exactly how this transformation is happening, why it matters to you personally, and most importantly, how to prepare for a world where your living room might become your hospital room. Let me break down what's actually happening right now that most people have no idea about. During the pandemic, hospitals launched emergency programs to treat patients at home. One system went from concept to first patient in just 10 days. What started as a crisis response has become something much bigger. Here's what hospital at home actually means. You're admitted to the hospital. You have a hospital room number. You're billed as an inpatient. But you never leave your house. Instead, nurses visit you multiple times a day. You have remote monitoring devices tracking your vitals 24/7. A doctor checks in via video daily. If you need an X-ray, they bring the machine to you. Labs? Done in your kitchen. Physical therapy? Your living room. Mass General Brigham built one of the nation's largest programs and now serves more than 16,500 patients, avoiding over 60,000 hospital bed days. And here's where it gets interesting. Their randomized trial showed a 7% readmission rate compared to 23% for traditional hospital care. That's not just better, that's 3 times better. The results are so compelling that this isn't staying niche. It's spreading fast. Now here's what nobody's talking about. This is about to become the default, not the exception. Healthcare researchers estimate up to $265 billion worth of Medicare care could shift from facilities to homes. That's not over decades. Much of this shift is projected by 2025. Think bigger. By 2035, economists predict $1 trillion in annual healthcare spending will move from traditional hospitals into home-based models. Let that sink in. $1 trillion. What does that actually mean for you? It means the healthcare system is being completely redesigned around one principle. Unless you absolutely need intensive medical equipment or emergency surgery, you're going to be treated at home. Some major health systems are projecting that 30% to 40% of all care currently provided in hospitals can eventually move to the home. That's not a small shift, that's a fundamental transformation. The technology making this possible is advancing faster than most people realize. We're talking continuous biometric monitoring through wearables, AI systems that detect problems before you even feel symptoms, and remote diagnostics that match in-person care. And here's the kicker. Employment for home health workers is projected to grow 21% through 2033, much faster than average jobs. The workforce is already preparing for this future. The federal government just passed legislation extending these programs through 2030. That's the signal. When Medicare commits 5 years of funding, they're not experimenting, they're building the new standard. Before you think, that's interesting but doesn't affect me, let me show you exactly how this changes your life. Your healthcare costs are about to change. Johns Hopkins reports savings of 19 to 30% compared to traditional hospital care. That means lower insurance premiums, smaller medical bills, and less financial stress when you or a family member gets sick. Your risk of complications drops dramatically. Every day you spend in a hospital, you risk hospital-acquired infections, medication errors, delirium, and muscle loss from lying in bed. At home, you're in a cleaner environment, on your normal schedule, with your support system around you. Your recovery gets faster. When you sleep in your own bed, eat food you actually want to eat, and maintain your daily routines, healing accelerates. The data backs this up consistently. But here's what really matters. This gives you control back. You're not a patient in a system. You're a person receiving care on your terms, in your space, with your family involved. For anyone over 50, this is your future. For anyone with aging parents, this is how they'll receive care. For anyone concerned about healthcare costs, this is the solution that actually makes financial sense. Okay, so how do you actually prepare for this shift? Here are 5 practical steps you can take right now. Step 1. Check if your local hospital offers this. 413 hospitals across 39 states already participate. Google hospital at home plus your city name. If your hospital doesn't offer it yet, they probably will within 2 years. Bookmark that information. Step 2. Review your insurance coverage. Medicare already covers these programs. If you have Medicare Advantage or private insurance, call and ask, do you cover acute hospital care at home? Document that answer. Coverage is expanding rapidly, but you need to know your situation before you need the service. Step 3. Prepare your home, even if you're healthy. This doesn't mean turning your house into a medical facility. It means having a dedicated recovery space that's comfortable and accessible. Think about, is there a room on the ground floor? Is there reliable Wi-Fi throughout your home? Is your home address clearly visible for medical staff visiting? Step 4. Build your support network now. Hospital at home works best when you have people who can help. Talk to family members, neighbors, or friends about being available if you need support. Create a simple contact list of people who can help with rides, meals, or just checking in. Step 5. Advocate for this option. When you or a loved one faces hospitalization, ask, am I eligible for hospital at home care? Many people don't know it exists. By asking, you're forcing the conversation and potentially accessing better, cheaper care. Bonus step. If you're caring for aging parents, have this conversation with them now. Ask, if you needed hospital care, would you prefer recovering at home if it's medically appropriate? Get their preference documented before an emergency forces a rush decision. Look, the hospital system isn't broken because doctors and nurses don't care. It's broken because the model itself is outdated. But here's the good news. We're witnessing a rare moment where the healthcare industry is actually fixing something, where technology, economics, and patient needs all align in the same direction. Hospital at home isn't just better care, it's care reimagined. And it's available right now. If this changed how you think about healthcare, hit subscribe. Drop a comment. Would you choose hospital care at home over a traditional hospital stay? I want to hear your thoughts. The future of medicine isn't being built in hospitals. It's being built in living rooms. And that future is already here.